Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video we're going to talk about the treatment of renal cancer. Now there are lots of different kinds of renal cancer, but the most common kind is something called renal cell carcinoma. Now symptoms of renal cancer can include a constant pain under the ribs, a lump in the abdomen, weight loss, and also blood in the urine. However, in many cases it's asymptomatic. Renal cancer is diagnosed using specific tests such as blood and urine tests, scans including ultrasounds and CT, and finally biopsy, where a small sample of tissue is taken from the kidney. Treatment of renal cancer depends on the underlying diagnosis, but it always involves a multidisciplinary team made of lots of different healthcare professionals. That includes doctors, nurses and surgeons and various other allied professionals. Now they come together to decide exactly the best treatment for you and your type of cancer. When you are diagnosed, your team will determine exactly how severe or the extent of your cancer is. If the cancer is isolated to the kidney itself and just within the kidney, then surgery, which is called a nephrectomy, may be your best option. If your cancer has spread outside the kidney, fortunately there are options to help limit or slow down the progression of the disease. We're going to go through a couple of the treatment options that may be available. First and foremost is surgery. This is also called a nephrectomy and it may involve part or all of the kidney. This can either be done as an open procedure or done laparoscopically or via keyhole surgery. The second treatment option is called embolization, and that's where the blood supply to the cancer is cut off to encourage it to shrink. Medication that's used for the treatment of renal cancer can either be immunotherapy, where the medicine uses the body's own immune system to fight the cancer cells, such as interferon alpha, or specific new targeted therapies, for example a drug called sunitinib, which directly inhibits the cancer cells itself. The final option is radiotherapy, and this is where we use radiation to shrink the extent of the tumour or treat some of the symptoms associated. It's important to bear in mind that advanced renal cancer may not be able to be cured, but there's lots of help available in terms of limiting the progression and controlling some of the symptoms. And that is the treatment of renal cancer in a nutshell.